Well, I put a belt up here because it does mean belt or girdle. This is significant because the shingles rash is often in a belt-like pattern around the body. And I also chose to do this presentation because shingles most commonly occurs in people ages 60 and greater, and that happens to be my patient population. But I want to say if anyone has any questions, this is an interactive presentation, so you can sort of ask your questions as we go along. Now, I found this slide in my research. I thought it was pretty interesting because it gives us a good depiction of how the shingles virus happens and occurs. So what we see here is a child. This is significant because usually people contract chickenpox when they're children. You have the blisters, you have the bumps, this goes away. However, the varicella zoster virus remains in our body. This is why we see the spinal cord up here, because what it does is after you've had the outbreak of the chickenpox, the virus will go and sort of hibernate in the cells of the nervous system. It's dormant there. And it can actually rest there for decades, very quietly. You don't know it's there. You don't know it's in your body. And then bam, you have some sort of insult. So this can be emotional stress. You can be taking certain medications. Your immune system can be down. You can have cancer, chemotherapy, and you'll end up with an outbreak of the shingles as an adult. Another important question is then, can I get the shingles from another person? I have a neighbor who has the shingles. Can I go to their house? Will I get it from them? And the answer to that is absolutely not. You cannot actually get shingles from another person. The only thing that you can get from a person with shingles is chickenpox. So people who have not had the chickenpox should not be in the presence of someone who currently has shingles. This is important to note. Now let's say, for instance, your grandchild is coming from another state and it's the holidays and you have a shingles outbreak. What can you do? The thing is, shingles is only spread when there is contact with a fluid-filled blister. So a cough, a sneeze, that's not going to spread the shingles. So what you can do to cut down on having it pass to another person is actually cover the rash. And this is believed to cut down on exposures to others. So then we move on to something a little bit more interesting. Yes, go ahead. Right, exactly. So only when it sores and there's fluid within the blisters. Now, if you've had the rash for a couple weeks and it's scabbed over, then you're much less likely to pass on the infection. So prior to the rash, usually people get this sort of, I would call it a feeling of foreboding. It's really medically called a prodrome. And so that includes itching, burning. Usually there's tingling on the side of the body where the rash is going to later appear. People can have a fever, a headache, muscle aches, and just a general sense of unwellness. And then bam, here we go, the rash that we all are familiar with. So usually within the first 1 to 2 days of having a shingles outbreak, the rash is in a blister-like pattern. Usually shingles can be found along the chest or torso, so this is why we have this lovely illustration for you here. Sometimes it can be around the eye as well. And so this lasts for a couple of days. Then the next 3 or 4 days, the blisters will progress to open sores and ulcers. And as we talked about, that's when you're really at your most infectious point. So you want to make sure you're not in contact with those who have not had chickenpox. And then 7 to 10 days is when we start to see a healing of the rash. Scabbing happens. And within a month or so, the rash has usually disappeared, and there's just scarring left. But during this whole time, there is usually pain associated with shingles. Fortunately or unfortunately, the pain can be mild or severe. And sometimes, I talked about that period before you get the rash where there can be that itching, burning. There's also pain that will start at that time. Now, usually the pain is concentrated in the area where you have the rash, but I have to say that usually the pain is worse the older you are. another thought is, well, what happens if I have the shingles? What can the complications be? Now, there are some cases where you have the shingles, you go to your primary care doctor, you get a medication, and you stay at home while you recover. But sometimes the course can be a little bit more complicated than this, and there might be a hospitalization involved there. Then you have to consider if you have these blisters, these ulcers on your skin that are caused by the virus, but bacteria can also get into that rash that you have, and then you get an infection, which causes more problems. Now, if you recall the picture where I had the shingles along the eye, when you have shingles in that area, it can lead to vision changes. If it gets around to the ear, there can also be some difficulty in that area as well. And then what I think is the most important and significant is postherpetic neuralgia, or this is another word for pain. So exactly what is postherpetic neuralgia? It's one of the most common complications in shingles, and I probably see maybe 5 patients a month with complaints of postherpetic neuralgia. And it's defined as severe pain that remains for at least 3 to 6 months after the start of the shingles rash. Sometimes the pain can become chronic, which usually we define as a year or longer, and that's when it's really bad because you start to have depression, other psychological issues, one's distressed, you become socially isolated because the pain is so intense that you just can't do your normal daily activities. So there's several different types of pain, and that's actually out of the scope of our discussion today, but shingles pain in particular is nerve pain. Another word for that is neuropathic pain. Now, if we recall, varicella zoster virus goes into the cells of the nervous system. So what happens is it actually causes damage to our nerves. That's how we get misfiring and dysfunction of the nerves and pain. So what we can expect with this type of pain is burning, numbness, tingling, itching, extreme sensitivity to the touch. I've had people who have shingles along the hairline, and it'll be 2 years after they've had the rash, and they say that they will have extreme sensitivity and difficulty even combing or washing their hair when this happens. Sometimes also there can be stabbing and aching associated with the pain as well. So I have to say that what you want to do is make sure you don't get it. I know this is surviving shingles, but one of the best things is prevention. So there is a vaccine. It was approved for adults age 60 and older in 2006, and it's called Zostavex. Now I have to say it may not fully prevent you from getting the shingles infection, but right now they're looking at rates of maybe 40% cut down. So there's a 40% chance that if you get the injection, you will not get the infection. But let's say you do get the infection. What's significant is that there is a great reduction in the severity of the outbreak that you have, and also it decreases the chances of you getting that long-term pain after the rash is resolved, also known as postherpetic neuralgia. Has anyone in here had the shingles vaccine? Okay, almost everyone. Almost everyone. I'm not going to point out those who haven't, but this is something to think about. Well, yeah, that's a good question. How many people have had shingles? Okay, okay. Now, did you have the shingles? I'm not asking anyone to tell their age, but was it after the age of 60? Okay, anyone before the age of 60? Okay, age 12, I believe, right? So it does happen. It can happen. Okay, we had the vaccine, but we still got shingles. So that's another question. Did anyone have the vaccine and then get shingles? 2. Okay, well, that looks about right. Or did anyone have the vaccine? Okay. Have the vaccine, got shingles, and others did not have the vaccine and got shingles. Is that correct? Okay. So what do? We got shingles. What is the natural progression? The first thing you want to do is if you see a rash on your body, the first thing you do is report to a physician. This is very important because they need to start antiviral medications for you within the first 72 hours. some of the medications that are used, one of them is called acyclovir. It's one of the more common medications, and it's important because what it will do is actually stop the virus from replicating in your body, okay? Also, it can hasten the healing of the rash, and there are some thoughts, it hasn't been completely proven with studies, that it will cut down on the pain that you have during your outbreak. So you've had the antiviral medications, you've done that. What else can you do? So I found this nice chart during my research, and I'm going to touch on a couple of things here. So first, reducing aggravating medications. This is actually pretty difficult to do, but some people find that while they have their shingles outbreak, they are also taking medications that depress their immune system. So medications for psoriasis, for example, medications for rheumatoid arthritis, also anyone taking opioid medications for pain, they might want to actually cut down on taking those medications during the outbreak to help give your immune system a boost to fight off the infection. Now, of course, you have to talk to your doctor about this because sometimes those medications are very necessary and cannot be stopped. Conventional medicine and treatments, this is what I deal with every day, so we're going to hold off on that. Immune system treatments, there actually aren't very many out there that have been proven, so not really worthy of much discussion. But herbal medicine and biotherapy, also another fancy word for herbal medicine, quite interesting. So there have been some studies. They've looked at a population of people in Japan and found that they actually have the lowest rates of shingles in the world. And it's been associated with them eating a huge diet of seaweed, a particular type of seaweed called undaria. So perhaps if you have not had shingles yet, you can go out to your nearest specialty store and see if they have any of that in stock. In addition, one of the main treatments that we use, although it falls under the herbal medicine category, is the capsaicin patch or capsaicin cream. Has anyone used that? Did anyone use that when they had? You tried it? It burned. So that's the thing. Capsaicin is the active ingredient in chili peppers. Now they found that if you put the patch on, one administration of the patch on top of the rash, it will relieve the pain for up to 2 to 3 months. But you said it burned. Exactly. Most people cannot tolerate it. Did you use the patch? The cream, did it help? Really? It burnt, right, so exactly. Right, exactly. So it's really funny that they've done these studies and they've shown that it works very well, but most people I talk to say that it burns so badly over this sensitive area that they can't use it. Food supplements. So vitamin C, vitamin B12 are known to boost our immune system. This is sort of anecdotal evidence, but it can't hurt to take these while you have the shingles virus, just to sort of help boost your immune system and fight things off. Now, when they talk about creative therapies, they're referring to music therapy. They've looked at a large population of patients who have long-standing pain after shingles and found that that's helpful. Then, of course, there are mind-body therapies. That would include going to support groups, visiting a pain psychiatrist, things of that nature. But I'm particularly interested in lifestyle changes because these are things that I can tell people when they come into the office in pain. All right, so once again, anecdotally, so there's no firm, solid, sort of large studies or evidence for this, it's thought that garlic can help to heal the blisters more quickly. Now, I don't see any problems with doing this unless you have an allergy to garlic, so I do tell patients that it's something worth trying. Has anyone heard that garlic can help with this? No. So it's something to consider. Now, also, processed foods. Very recently, and over the course of the past few years, there's been this big push for us to eat clean, which means we want to avoid processed foods. Because we do know that the larger your diet is of processed foods, the more depressed your immune system is. So maybe if prior to your outbreak of shingles you were eating a lot of fast food every day, you might want to switch to the more healthy veggies and such, so that you can boost your immune system and help with the healing process. And then I think this is particularly interesting. Lysine is an amino acid which actually can stop and inhibit the replication or the production of the virus in your body while you have the outbreak. So while you have a shingles outbreak, you want to eat foods that are rich in lysine. So that includes fish, poultry, beef, lamb, beans. Now, if you're a vegetarian, this is going to be a little bit difficult. Now, arginine is also amino acid found in foods, and it's the opposite of lysine. It's its enemy, because what it will do is it will lead to multiplication of the virus. So you want to avoid foods that are high in arginine. Now, you're going to notice that beans are found on both. Now, I looked several places to try to figure out and distinguish which beans are which, and I could not find conclusive evidence on this. So you'll have to consider that very carefully. But you do want to avoid nuts, soy, and wheat. Yeah. Mm-hmm. No, because when you have postherpetic neuralgia, the shingles virus is usually no longer replicating. So it's dormant again, lying within your cells, waiting for another insult to come alive. So you can eat a regular diet during that time. Right, exactly. But that's a very good question. This is only when you have an active outbreak. So what I'm going to talk about next is what you can do when you actually have postherpetic neuralgia. So that would be traditional medicine. And this is what people usually come to my office to speak about. All right. So if you think back, I said that the varicella zoster virus hides in the cells of the nervous system, and it actually causes damage to your nerves. So the medications that we use actually alter the nervous system. They alter the misfiring of the nerves that cause pain. So when you see a pain physician, or maybe even your primary care doctor, one of the first medications they're going to use is an anticonvulsant medication, also known as gabapentin. Did anyone take gabapentin, or is anyone on gabapentin? Lyrica? Okay, Lyrica is another one of those medications. So gabapentin is great for any type of nerve pain. It's the first line. If you have postherpetic neuralgia and you've never been on it, it's something definitely to try if there's no other reasons why you can't take it. It is traditionally an anti-seizure medication, and I do have people come in and say, well, what about this? But they found it's not really good. It's not great for anti-seizures, but it does help with nerve pain. So that's something to consider. Lyrica is sort of its more expensive cousin, and people who can't tolerate gabapentin, usually I will try them on Lyrica. Next, we talked about the capsaicin cream and patch. We've heard from our survivors here that that might not be the best choice because of the pain and the burning that comes along with it. And I will tell you that I have not actually had anyone who has been able to tolerate it over the course of a couple of years. Now, something that people do like, the lidocaine patches. Anyone used the lidocaine patches before? Did it help? No. You liked them. Okay. Well, age 12. See, there could be a difference there. Did you use them when you had the shingles? Okay. So the idea with the lidocaine patch is basically lidocaine is a numbing medication. So you put it on the area that's extremely sensitive, and it numbs it. So if it's along your torso and you're trying to wear a shirt or something like that, the idea is that you can put your lidocaine patch there. It's going to sort of protect, numb, and cover the area. So people do like it for this. And actually, insurance companies will no longer cover lidocaine patches for anything except postherpetic neuralgia because it's really the only thing that it's found to be helpful for. Now, people do use it for other things, but that's just the lay of the land right now. Antidepressant medications work very similarly to anticonvulsant medications because they do alter the balance of the nervous system and help the misfiring of those nerves. And one that we use, amitriptyline, sometimes can help. Anyone use that for their, did it help? Oh no, did it help? Oh no, okay. Well, so that's the thing. This is one of the ones I put up here, but oftentimes we have to rotate through a lot of medications in these drug classes to see what we can do to find the delicate balance to help. Now, other medications, opioids. People do use this because, of course, it is a type of pain. Tramadol is one that it's popularly used, morphine, things of that nature. The only thing is we talked about the fact that usually shingles occurs in a population older than 60. It becomes a very delicate balance and risky to use opioids in this population because you don't want to get pain control and then suddenly you can't remember anything because that's not going to be helpful. So I find that what I have to do is I have to actually use a combination of all of these things to strike a delicate balance to help with the pain control. Now, I will say that it can take quite a bit of time. We live in a society now where it's sort of the microwave generation. We want to go to the doctor or we want to go to the restaurant. We want to get it and we want our pain to be gone. But that's not actually how it usually works in practice. And it can take months. It can take months to come up with the right combination to sort of make sure that the pain is brought down to a level which is tolerable. But I have seen people after, a series of visits, after a series of tries where their pain will decrease from maybe an 8 out of 10 to a 2 out of 10, and it becomes tolerable and they can sort of live a comfortable life again. Right. Any questions? Yes. Of the outbreak. So scratching, what scratching is going to do is get the natural bacteria that live within your skin within those sores, within those blisters, within the rash. Oh, post sores? Well, scratching is never a good thing to do on your skin because that leads to a different type of pain. So it's not going to affect the inherent nerve pain that you have there, but it is going to affect those other pain receptors in your body and lead to a different level of pain. So if you can avoid scratching, then you might want to do so. But it's not going to worsen your course of having postherpetic neuralgia, but you can get another layer of pain there and complicate the waters. Yes. You have a question? Mm-hmm. So these are really the only options. These are really the only options that can help. Paladril. Interesting, interesting. Is this over the counter? Okay. Okay. Right. Well, that's mhm. Now, what does it help with? Does it help with itching or does it help? Really? Mhm. Really? And it lasts for 2 hours? Oh, 2 hours. Right. Oh, well, that's very good to know. If you get the pain at all. That's interesting. I've not actually heard of the use of that, but I'll definitely add it to my list of things to recommend. Mhm. that's the thing. There are a lot of topical creams that can help, but as I said, it's a matter of finding the right combination that's going to help. These things that I talked today are known to sort of consistently work in a large, amount of people, a lot of studies, but that's what you want to do. You want to be able to sort of help yourself. Right, exactly. Exactly, exactly. All right, so the range of doses for gabapentin, the maximum dose for gabapentin is 3,600 milligrams. Yep, that's kind of high, but that's what they found to be safe. Uh, 30 a day. So people do take up to 3,600 milligrams a day. Now, what is safe for this? I usually start people off, depending on how old you are, what other medical conditions you have, I might start as low as 100 milligrams a day. And then what you do is you go up gradually, and the goal is to get to the highest dose with the least amount of side effects and the most amount of pain control. So on average, I like to see people on about 900 milligrams a day, on average. So Lyrica, the maximum dose is somewhere between 150 and 200 milligrams. And I will, once again, I'm pretty conservative, so I will start as low as 25 milligrams a day with the same goals in mind. Absolutely. So neither one of these medications are what we consider addictive, but your body does become very tolerant to them. So that means that when it's time to decrease the medication, you usually need to do it with the help of your doctor and decrease it very slowly. So just as we increase it so that the body can get adjusted to it on sort of a scheduled basis, before you stop it, you want to make sure to slowly wean yourself down. I've seen patients who they felt great. They've felt great for quite some time, decide they want to stop it, and then they end up in the hospital just because they, stopped 900 milligrams of something that they've been taking for years. Mm-hmm. You tried vinegar? And how did that work? It seems like it would burn. No, no, no. Yeah. It seems like it would burn. I would be cautious. Now, I would probably get this Caladrill. This sounds like something I'm going to tell people to look up, but right, right, right. So that's probably something that I'll add in. Mm-hmm. 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 Well, I've not actually seen any research on that, so I can't really comment upon that. So I think whatever, if cold towels are the only thing that gives relief, then I would continue to do that. So I'm not sure, but I can't believe that acupuncture is very helpful. Oh, it wasn't helpful? So it can be helpful for some. I do have people who use acupuncture, and the thought is that what it does is it sort of interferes with the processes and impulses that travel through the nervous system. So in theory, it might help certain people. They've actually done MRIs, PET scans, and they look at parts of people's brains that light up when they're in pain. And then after they have maybe 8 sessions of acupuncture, there'll be less lighting up in that area, suggesting that the pain levels are less. Now, it's another one of those things that you have to try to see whether you get relief. Mm-hmm. Right. Right, exactly. And so another thing you have to remember is when I see people who have postherpetic neuralgia, rarely do I see anyone whose pain ever completely goes away. What we usually see is with a combination of things. No one has ever told me, oh, all I do is use gabapentin and my pain is now a 0 and I no longer have it. Usually it's I use lotion, I use gabapentin, I walk 2 miles a day in the morning with my friend, and my pain levels can be as low as a 2. So realistically speaking, the pain is most likely not ever going to be a complete 0, but the goal is to find something that will, make it so that you can still live a tolerable lifestyle and not be on the sofa at home. Mm-hmm. So opioids, hydrocodone is one of the opioids that we do use, that we do access. There's oxycodone, hydrocodone, morphine, fentanyl, any number of those medications, and it's definitely one of the medications within the arsenal to use. The only problem is, we talked about there are different types of pain. Opioids are not known to necessarily work on the receptors that cause nerve pain. Now, they will attach to different receptors in your body. They can cause relief, but they usually don't take all of the pain away. So the burning, that's not really going to go away with opioids, but it can take the edge off. So yeah, I will routinely, if I think that that's something that's going to provide relief, I'll start out low because, like I said, we want to make sure that we don't get any side effects with the treatment. And unfortunately, opioids also, like hydrocodone, they can depress the immune system. So you have to be very careful. It's once again a balance, because if you take too many of them, you could be setting yourself up for another shingles outbreak. So that's why it's a balance. It's a balance. But yeah, it's definitely an option, I would say. What's the maximum? So I think that sort of depends upon what your doctor is comfortable with. And it depends on the individual patient and what other kind of medical problems you have. I would say usually with that particular medication, I start at the lowest dose, but that's with any medication. So I think with hydrocodone, I start at maybe 5 milligrams and see how we do, but I never keep a person on just hydrocodone since I know that it doesn't necessarily work specifically for nerve pain. I'll usually start another medication in concert with that so that we can sort of work different avenues to try to get some relief. Gabapentin, so things I tell people to look for would be sedation. That's usually one of the biggest problems that people have. They cannot tolerate it because it makes them too sleepy. Another thing that one wants to look for, swelling in the legs, swelling in the extremities. People will say that, I'm feeling great, my pain is almost gone, but my legs are twice the size that they were. So this is usually a pretty obvious side effect. Also, gabapentin, unfortunately, because it does work in the nervous system and with the chemicals in your brain, it can lead some people to have depression. So they'll also say, I'm feeling great, but I cannot get out of bed. So these are things to look for. But I will say that gabapentin on the whole in most people is tolerated very well. People can take gabapentin for years, and it's pretty safe to do. Same with Lyrica, because they're very, very similar. So people do nerve blocks. I do nerve blocks, but it depends on where exactly your pain is, where it occurs. If you have the shingles outbreak on your face, there's really not a nerve block that can be done there to be helpful. Now, if you do have the shingles outblock around your torso, there are nerves that come out of the spine that actually correspond to that area. What some physicians will do is they will do an epidural steroid injection. And the idea is that numbing medication and steroid will sort of coat those nerves and decrease their malfunctioning and misfiring and lead to some pain relief. Now, for temporarily, usually 3 to 4 months. 3 to 4 months. Now, I will say that it hasn't been found to consistently provide relief. It will work with some, and it's definitely worth inquiring about, but I haven't found it necessarily to be that helpful. You had. Well, that's the thing. Shingles, I mean, it's a very funny thing because it goes into, so let's say, for instance, if you were lifting a heavy box and you pulled the nerve in the middle of your back, it's pretty easy to know that it's right there. It's right to that area. But shingles doesn't operate that way. It might be hiding in the cells of that nerve, but it can also be hiding in the cells above there and adjacent to there. But the block that we're going to do is only going to cover a single distribution. So while you might get pain relief in a quarter of the area where you have pain, it won't be able to reach others. So that's why we don't do them consistently, but it can be tried. No. So there's no real cure, but I will tell you that I find that my most determined patients who come consistently, that they're willing to try things, we do eventually get their pain controlled somehow. That's why I would urge you, if you don't already have a pain physician, to see one, because I actually had a patient who had shingles on his face. He had a wonderful primary care doctor who tried all of these medications, a great majority of these medications, his pain was down to a 4. But every time he went out into his garden and he was picking weeds, he would sweat and it would irritate the rash. So he came to see me and I was like, well, what can we do? What can we do? So I was like, why don't we take one of those lidocaine patches and cut it up and put it here? And it actually helped tremendously, especially when he gardened. So it actually he needed another eye. Now, his primary care physician already given him the patches, but, I was the one who said, okay, let's cut it up. So that's the thing. You've got to try different avenues. In fact, his primary care physician said, listen, let's say his name was John. Come on, John, we've tried everything. Why do you even want to pursue this? But the thing is, you have to continue to work at it to try to find relief, because it can happen. It's very frustrating, I know, because I have seen it, but it can happen. Yes, absolutely. Shingles is medications for shingles are usually the best covered. So there are 4 branches of our pain care offices. There's one at the Heart and Vascular Center here at the main hospital. I have an office at the Heritage Harbor area in Bradenton. There's one off of Clark Road, also in Sarasota, and there's another one in Osprey. Okay, and there are 3 pain care physicians, and so definitely it's worthwhile to Osprey, Blackburn Point. Yeah. Have a very good physician there who can definitely, but that's the thing, most pain physicians are well versed in postherpetic neuralgia because it is common. Yes. Right. So you're at the same risk as getting, yes, exactly, because what's happening is they're injecting a version of the virus within your body, which then goes within the cells of your nervous system and lies there quietly waiting for an insult to happen. You have shingles. Well, the thing is, you want to make sure that. So the thing is, if you were to get shingles or the chicken pox at an older age, usually it's more severe. Just as we talked about, have someone here who had shingles when they were 12. Probably the pain was not as severe as the pain that one would get if they were 52, 62, 72. So we want to make sure to have people vaccinated young so it's already in their system and they're not seeing their first outbreak. Because even chickenpox as an older adult can be extremely painful in a long course. Mm-hmm. So the Zostavex, which is out right now, is only provides 7 years of immunity. 7 years. They haven't previously required people to get booster shots, but it does make sense that once the new one comes out, you discuss it with your primary care doctor to see if it's worthwhile in getting it, because you can get shingles more than once. Now, usually it only happens in someone who has a really severely depressed immune system, and that would be someone who's on chemotherapy, cancer, things of that nature. But it is a possibility. No, right, 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 right. I've seen the reports, but I haven't seen any studies about any long-term effects. So I would not yet be encouraging my patients to get it until I know a little bit more information about it. Because we have to be, we have to be careful about avenues that we pursue. But I'm conservative, so I have to say that. I don't want to cause more harm than good. Questions? Yes. Yes, absolutely. The same things. And now I can tell you what usually happens is I'll come in, or a patient will come in to me and they'll say, you know what, I have a lot of pain and it just goes, it wraps right around my body. Now this is going to lead my mind down a course of different things, but even if you don't have the outbreak of a rash, the pain is usually in that belt-like band distribution. So the treatment is usually largely the same. It can happen. It definitely can happen. Burning, itching, numbness, tingling in the area. It's rare, though, extremely rare. No, it doesn't. And that's because of the distribution of the nerves in the body. It'll stop right around the middle. Right. So the reason is, like I said, right now the vaccine that we have only provides you with immunity for 7 years. You're unlikely to get a shingles outbreak when you're younger than 50. So 60 is the recommended age to get the vaccine. And that's why. Because, really you've got this vaccine for no reason, because the chances of you actually getting shingles is low when you're younger than that age. Acyclovir, that's that antiviral medication that you have to take within the first 3 days of having the rash. Within the first 3 days. Did you take it within the first 3 days? Right, exactly. So that's the helpful period of time. That's the sweet spot that helps to cut down on having a long, complicated course. Right. Right. So the acyclovir, the only thing that acyclovir does is it helps to stop the virus from replicating in your body. So once you have the shingles, it stops that virus from exploding so that you don't have a prolonged course of the shingles. What I mean by that, though, is so you have to make sure you separate between having an active rash on your body versus having postherpetic neuralgia when the rash is healed. So usually, if you take the acyclovir within 72 hours, the natural course is that that rash will heal up within 4 weeks. Now, you might have pain that lasts for a longer amount of time after that, but the actual shingles is over. That's postherpetic neuralgia that you have afterwards, which is what I suspect you had, which would mean that the acyclovir worked well. Did you have pain that lasted long, or did the actual rash last? Mhm. Mhm. Get rid of the actual scarring that you have left from the rash? Right. So I mean that's the course of time, unfortunately. It is, I mean it's unfortunate, but it's the course of time that will help with that. Mhm. So that's the thing. Everything that I talked about today is in general. But it can happen that you can have a longer course of shingles depending on what other kind of medical conditions your body has and your immune system's ability to fight it off. So it's not unusual that you could have a prolonged course depending on what else is going on in your body. But it's not typical to happen. Usually the rash will heal. You might still see evidence of it, but I've seen patients maybe 3 or 4 years before it's completely gone, evidence that it's no longer on the body. But active blisters, usually that's gone within a month in most cases. Mhm. Mhm. Exactly. 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 I mean, it's irritating the rash that you have. So I would suggest, do you have a pain doctor? Oh, so this is an opportunity. I would suggest you probably, this is the time. This is the exact type of presentation that we like to see because we can work a little bit closer with you to kind of figure out what we can do to help you. So I have to think about it. That's the thing. I don't make any rash decisions. I would have to sit down with you. I would have to figure out when you have the most pain, when you sweat, why, things of that nature. And then I would probably be able to come up with a treatment plan. Mm-hmm. Mm-hmm. Right. So with fibromyalgia, she would not have to be concerned because that's just generalized pain throughout the body, and it's not known to decrease the effectiveness of your immune system. So people with fibromyalgia, that would be fine. When it's questionable is when you do have something like cancer or you have liver disease or you have HIV, AIDS, something like that that depresses the immune system, when you really need to talk closely with your primary care doctor about whether or not a vaccine would be safe to have on your immune system. Mm-hmm. Questions? Yeah. Shingles. That's very possible. That's very possible. I did have a patient come in a couple weeks ago who said, I've been to all these doctors and my ear just burns. Turns out it had the shingles. So it is very possible. Yeah, yeah. Don't cut off your ear though. Let's try to avoid doing that. Right. Well, thank you, everyone. You've been a wonderful audience.